to mark World Physiotherapy Day, we have Daniel, fondly called P-Dan. He's a physiotherapist, a media influencer, and of course a leadership enthusiast. And this year's focus is osteoarthritis and the role of physiotherapists in its prevention in the management of people affected by it. It's great to have you, P-Dan. You're welcome.
Thank you very much.
Okay, so maybe let me start from the most obvious one. What is physiotherapy? It's World Physiotherapy Day. Exactly. What is physiotherapy, and what does this day? Why the commemoration?
Well, I think I would say that physiotherapy is an healthcare profession. We assist people to restore, to maintain and maximize their function, their movement, their strength. And so basically, we help people to move and function. Those are the keywords. And so we help people to move and function throughout their lifespan. So, and I believe that physiotherapy is a developing area of study. The world is not yet, well aware of it yet. But then it's a limitless world of knowledge and possibilities. And I believe that from birth to death, at one point in everyone's lives, everyone will require physiotherapy.
Physiotherapy, right? That's nice. So, it's World Physiotherapy Day, and the focus for this year is osteoarthritis, right? Okay. Arthritis is what people can, people can identify with, but what is osteoarthritis?
Yeah, osteoarthritis is it's a common joint condition. It affects any movable joint, most commonly the knees, the hips, and the hands. Causes? Basically, the cause is quite not known yet, but there's some factors that could increase susceptibility.
Exactly. To it. Yeah. What are those factors?
I think the first one I would mention is the age. Exactly, because as you age, your risk of osteoarthritis increases as you get older. And also, we have previous joint injury, which occurs basically both in children and in adults. And like I said initially, as you get older, your risk of getting OA increases. But in children, it's called juvenile osteoarthritis. Here is as a result, the precursor here is as a result of trauma, not necessarily as a result of aging. Okay. You understand? So that's that. Then we have gender. Studies have shown that osteoarthritis is more common in women than men. And also we have overweight and obesity. This puts strain on the joints. On the joints? Exactly. That's easily understandable. Exactly. So it puts additional strain on the joints, which increases joint inflammation. Wonderful. Okay, so is there a cure, or is it just based on prevention? How do you manage it if you are diagnosed of osteoarthritis? Well, I think the first thing I would say is that it can be very hard to keep moving when you have osteoarthritis. But physiotherapists are in the best position to give you the management, to manage your condition, to help you cope, to help you relieve your pain. So there's no outright cure? Basically, we do conservative management, but I would say that exercise is the first line of management for osteoarthritis. And it is evidence-based because all the things that we do as physiotherapists are based on scientific evidence, because we see that these things have results. We've seen results over the past many years, and it's evidence-based because what we do as physiotherapists, we help you to choose the best exercise that's safe for your condition. We prescribe exercises, unlike the traditional medical practitioner that would probably give you concussions without dosage, and eventually patients come to the hospital when the osteoarthritis has gone to a worse stage. Yes. And that's why we recommend people to come to the hospital for physiotherapy management. And so exercise, it's appropriate for all people, regardless of your age, regardless of your symptoms of osteoarthritis, regardless of a level of disability. And so, like I said, we prescribe exercises, and we ensure that these exercises are both safe and achievable.
Now, a number of people, if two people are diagnosed with osteoarthritis, let's say a knee joint, right? Is it like the exercises? Can you say it's a one size fits all, or you have to look for a unique diagnosis and tailor your exercise to fit you uniquely?
Yes, exactly.
Now, this has to do with, why I mentioned this is that some people might feel those joints and, okay, maybe they Google something and said, okay, I have this pain in my joints. I'm talking about the need to actually go see a physiotherapist so that you can get a unique diagnosis. Is there a need for that, or if I just have a joint pain on my knees and all that, okay, I know what exercises to do?
Well, I think there are quite a lot of differential diagnoses to osteoarthritis.
Okay.
That's why we do a lot of exercise testing and exercise prescription. So like I said, it's evidence-based. So we see that these things work. And also with our clinical expertise, which is very important because a physiotherapist must have the skill to be able to manage a condition. So when the patients come to the hospital, we do a full joint exam or full body examination. Then after that, we know the appropriate management strategy to apply for the patients.
All right. So today is World Physiotherapy Day. Is there any commemoration to mark the day? Is there anything happening anywhere?
Well, I think across Nigeria, different institutions are, in one way or the other, having activities and programs to celebrate the World Physiotherapy Day. I think and even across the globe, because the celebration is across the globe.
It's a global one.
So, like, for example, a lot of people, like throughout this week, there are a lot of activities from different institutions, hospitals, and what's it, organizations.
Exactly. So you can go out, because I know I've heard of some people that will say they'll have free diagnosis now, free consultations, and all of that. What are you doing anything?
Well,
free?
I think
you give us some consultation online or something.
Well, I think they can reach out to me.
They can reach out to you. Well done, Peter. It was great talking to you. And yeah, hopefully everybody out there understands how important this is and gets to take care of themselves.
Yes,
Thank you very much.
Thank you very much.
All right, that's it. It's World Physiotherapy Day. So just go out there to a physiotherapy center. I know there are a number of them, different health centers that are having free consultations today, and like Peter said, across the week, and get to know, the kind of things you can do, the kind of exercises you can do to ensure that you can manage the condition if you have it.